Thank you for reviewing Classic Auto Group's 2017 Employee Benefit Program. Open enrollment will be held November 3rd through the 23rd this year. The elections you make during open enrollment will go into effect on January 1st. Those elections will remain in effect through December 31st, and you can't make any changes during the plan year unless you experience a qualified life event. If you have one of the life events listed on this slide, please make sure that you notify HR of the life event and that you want to make a change to your benefits within 31 days of that event. Otherwise, you lose your opportunity and you have to wait until open enrollment next year. There are several things that are not changing for 2017. First of all, your medical carrier will remain United Healthcare, and all three of your current medical plans will remain in place with no benefit changes and no rate changes. There will also be no rate changes for your dental or vision plans. Online enrollment will still be through Benefits in Hand, and your Employee Assistance Program will be through Care24 and United Healthcare. What is changing for 2017? Well, you are going to have a fourth medical plan option. It's a qualified high-deductible health plan, which will allow you to have a health savings account, and I'll go through that in detail in just a few minutes. United Healthcare will be the administrator for your dental, vision, and life plans as well. If you're happy with your current plan elections and you don't want to make any changes, you don't have to log in to Benefits in Hand. Your current elections will carry forward to next year. If you wish to enroll in the new plan option or make any plan changes or changes to who you're enrolling in the plan, you must log in and make those changes. You can access Benefits in Hand from home or from work, and detailed instructions are in your benefit guide. Please make sure if you log in to verify all of your personal information, because we will need you to verify your Social Security numbers and dates of birth for all covered members, so have those handy when you enroll. Remember, if you have any questions about your benefits or if you need help enrolling, call the Employee Response Center at 1-866-419-3518. They're available to take your call Monday through Friday, 8 to 5. Let's review some common terms before we talk about your medical plans. A deductible is the amount that you have to pay for covered health services before your health plan begins to pay. The deductible may not apply to all services, and you may have more than one type of deductible. Coinsurance is your share of the cost of covered health care services, calculated as a percent, for example, 20%. This is calculated on the allowed amount for the service. You pay coinsurance plus any deductibles that you owe. Coinsurance is not the same as a copayment or copay. A copayment or copay is a fixed amount, for example $15, that you would pay for a covered healthcare service, usually when you receive that service. You will pay a copayment or the allowed amount, whichever is less. The amount can vary by type of covered healthcare service depending on your plan. An out-of-pocket limit is the most that you will pay during a policy year before your health plan begins to pay at 100%. Once you reach the out-of-pocket limit, your health plan will pay for all covered services. This will not include any amounts over the amount that we allow when you see an out-of-network provider. Your copays, coinsurance, and deductibles, including pharmacy, all count towards meeting that out-of-pocket limit. In-network services and out-of-network services have separate out-of-pocket maximums if your plan includes out-of-network coverage. All of the classic plans have a network. You can view participating providers at www.myuhc.com. If you use an in-network doctor or other healthcare provider, you will receive the highest level of benefit under your plan. It's your obligation to ensure that you are seeing in-network providers. Some plans have no coverage when you choose a non-participating provider. You do not need a referral on any of these plans to see a specialist. You can choose a specialist from the network and receive in-network benefits. Prior authorization is the term used for getting approval before you gain access to medical services. Services that require prior authorization are noted in a list of common medical events. And to get approval, you call the phone number on your health plan ID card. If you're in network, then your physician will get your prior authorization. Here are your 4 plan choices. They are all with United Healthcare, and they all use a network of providers. The difference in the networks is really whether or not there are out-of-network benefits available. All of the in-network providers are the same on all 4 plans. The base PPO and the buy-up PPO allow you to have out-of-network benefits, whereas the Flex Zero plan and the Freedom HSA plan are in-network only. You have a deductible on each plan. The deductible is listed here, and the individual deductible is listed first. So on the Flex Zero plan, it's $3,000 for an individual. But if you're covering multiple family members, no single person will have to pay more than $3,000, but your whole family would not have to pay more than $6,000. And that would apply across the board. So on the base PPO plan, no individual would have to pay more than $4,000 in deductible, and your entire family would not have to meet more than $8,000 of deductible. The buy-up PPO is $2,000 and $4,000, and the Freedom HSA is $4,000 and $8,000. Once you meet your deductible, then the plan pays coinsurance. Listed here is what the plan pays, so you would pay the difference of that and 100%. So on Flex Zero plan, the plan pays $80 and you pay $20. On the base PPO, the plan pays $70 and you pay $30. On the buy-up PPO, the plan pays $80, you pay $20, and the same for the Freedom HSA. Once you meet your deductible, the plan would pay 80% and you pay 20%. You will pay that coinsurance until you meet your out-of-pocket maximum. And there would be no individual in your family that would have to pay more than that out-of-pocket maximum listed first. And then if you're covering multiple family members, then your family as a whole would not have to pay more than that second number in a calendar year. There are office visit copays available for your base PPO and buy-up PPO. On the Flex Zero plan, you don't pay a copay. It's totally free for 3 visits. After you meet those 3 visits, you have to meet your deductible, and then charges are applied to your coinsurance. On the Freedom HSA, there are no office visit copays. You will pay 100% of the eligible charge, and that will be applied towards your deductible. And once you meet that deductible, then you're only responsible for 20% of the remaining charges. Same thing for specialists, and if you're on the buy-up or base PPO, you can note how much you would pay for a primary care doctor or a specialist. You'll see that there's actually 2 copayments listed under specialty for the base and buy-up PPO. The first copayment listed would be if you see a premium designated doctor with United Healthcare, and then the second is if you see a specialist that's not premium designated. Preventive care on all 4 plans is covered at 100%. Diagnostic services would be things like outpatient lab and x-ray. You can see the level of benefit here for each plan. Complex imaging, inpatient hospitalization, outpatient surgery, and emergency room. Please note that the emergency room is always your most expensive place of care. If it's not a true emergency, please utilize your urgent care benefit. Urgent care is much less expensive, and it also costs you less out of your pocket, and you don't have to wait quite so long as you would in an emergency room for a non-emergent situation. If you go out of network on the Flex Zero plan or the Freedom HSA plan, you have no benefit available, so you'll be paying 100% of those charges. If you go out of the network on the base or buy-up PPO, you have a separate deductible, separate coinsurance, and separate maximum out-of-pockets than you do for in-network. So those do not, your in-network does not satisfy your out-of-network and vice versa. They are totally separate. If you need prescription drugs, you can see your copayments are listed for each plan. Tier 1, Tier 2, Tier 3, and Tier 4. So when you get a prescription, you'll simply pay your copayment. The difference to that is on the Freedom HSA plan. You pay 100% of the discounted rate until you meet your deductible, and once you meet your deductible, then you just pay 20% until you meet your out-of-pocket maximum. There is a mail order benefit. If you get a 90-day prescription and send that to mail order, you'll save a half of a copayment for a 90-day supply. I'm sure that you're familiar with the terms generic, preferred brand name, non-preferred brand name, and specialty medication. Well, United doesn't use those terms. They strictly organize their medications by tier, and those tiers are associated with the cost of the medication. If you're on the flex-free EPO or the base PPO, your copayments will be the same regardless which plan you're on. If you're on the buy-it PPO, your copayments are a little bit less, and if you are on the Freedom HSA, you actually don't have copayments. You pay 100% of the negotiated discount price, and that will be applied towards your deductible. After you meet your deductible, you will be responsible for 20% until you meet your out-of-pocket maximum. Choosing generics will save you money because those are lower cost medications. The Freedom HSA account is a qualified high deductible health plan, and because it is a qualified high deductible health plan, you would be eligible to have a health savings account, which is funded with your tax-exempt dollars to help pay for your medical expenses, including deductible coinsurance and certain services not even covered by your medical plan. HSA plans have special tax advantages. Therefore, the IRS defines specific rules on participation and the maximum amount that can be contributed into the account. In order to contribute to a health savings account, the IRS requires that individuals must be enrolled in a health savings account medical plan, which the Freedom HSA qualifies. You cannot have any other health coverage, so you can't be covered by a spouse on a medical or pharmacy plan. You can't be covered through Medicare Part A or B, and you can't be covered through a general purpose flexible spending account, either yours or your spouse's. And you cannot be claimed as a dependent on another's tax return. There are contribution limits. If you're under the age of 55 and not enrolled in Medicare, you can contribute up to $3,400 tax advantage money for individual coverage, and up to $6,750 for family coverage. If you are 55 or older at any time during the year, you can contribute an additional $1,000, and that's considered a catch-up contribution. To make the maximum contribution in the calendar year, you must meet all the requirements for the full 12 months. If any of the requirements are not met, then the maximum contribution is prorated for each month that you're not qualified. The biggest question I get is, why would I want to enroll in the Freedom HSA plan? Well, currently, 100% of the premiums you pay out of your pocket are paid to United Healthcare, regardless if you use the plan or not. In addition to the premiums you pay, you also have to pay your copayments, deductible, and coinsurance. With the Freedom Health Savings Account, you're going to be paying approximately what you would for the buy-it PPO plan. But included in that, you will have funds deposited into your HSA account for you to use for your qualified expenses. You don't have to use the money. You can save it for future expenses. And on employee only, employee spouse, and employee children, you can actually contribute additional funds if you'd like, so that you can fully fund your health savings account. So if you're employee only, the monthly deposit that will be made for you is $196.83. That's about $2,362 a year. You can contribute an additional $86.50 if you'd like to, so that you can increase your savings. For employee spouse, your monthly deposit will be $450.54, which is about $5,400 a year. If you'd like to fully fund your health savings account, you could contribute up to $111.96 additionally each month. If you're covering just yourself and children, the deposit that would be made is $387.21, which is about $4,600 per year, and you could contribute up to an additional $175.29 per month to fully fund your account. If you're employee only, your monthly deposit is $562.50, which is $6,750 a year, which means you're already funded to the maximum, so you would not be able to contribute any additional funds. One thing to remember is the health savings account is really a bank account, so you can't spend the money out of your account until funds are in your account. But once the funds are there, you can use those funds to pay for your deductible, to pay for any co-insurance, to pay for your medications. If you have a big expense during the beginning of the year and you don't have money in your health savings account yet, you may have to work payment arrangements out with your providers if you do have that large expense. There are several reasons you might want to consider enrolling in the Freedom HSA plan. First of all, cost savings. Instead of paying the carrier those premiums, pay yourself some and be able to use those for your qualified expenses. It's tax-exempt dollars that you can put into these accounts, and when you use them for qualified expenses, they're also still tax-exempt. And if you don't use them, they're in an interest-bearing savings account. The long-term financial benefits are clear. If you don't want to use these funds, you can save them year over year over year in these interest-bearing accounts. You can use them for your future medical expenses. The funds roll over year, you won't lose them, and it's your account. You take it with you if you ever were to leave employment. And then finally, choice. You control and manage your own healthcare expenses. I've put together a few scenarios so that you can consider your options. If you're a healthy single person, why would you consider the Freedom HSA? Well, the individual deductible on the plan is $4,000 and the co-insurance is 80%. Your out-of-pocket maximum is $6,550. From the premiums that will be taken out of your paycheck, the employer will be funding $2,361 into your health savings account. You could put additional funds into the account, but in this example I'm not showing that as being done. So your total HSA funds available to you are $2,361. In this example, I put together side by side if you were in the health savings account or the buy it PPO and several different benefit coverages. So office visit, if you have an office visit with a lab, urgent care visit, totaling your incurred expenses for the year under the HSA would be $385, and similarly under the buy it PPO it'd be $150. But if you're on the health savings account, part of your deductions have been put into that account for you. So $385 would be paid towards your deductible. You could use the money out of your savings account, and you would still have a balance at the end of the year of $1,976. If you're on the Buy It PPO plan, you're going to pay about the same amount, and you're not going to have that savings account. So you're going to have to pay for everything out of your pocket for your expenses. And you won't have anything left at the end of the year in your health savings account. So if I'm comparing the two on this scenario, the person in the Freedom HSA saved $1,976, and the Buy It PPO paid an additional $150 over and above the premium. If you have a chronic medical condition that requires routine care, you might want to consider your options very carefully. In this example, I'm doing about the same thing. I'm taking certain services, applying what the benefit would be under the health savings account and the Buy It PPO. In the end, on this example, I even have the employee funding their health savings account in full, so they're putting in an extra $1,039 each year to get a total health savings account of $3,400. That $1,039 is above the premiums that would be coming out of the paycheck. So under the health savings account, your expenses would be $4,345. $4,000 of that would go towards a deductible. $3,400 of that would be paid out of the health savings account. Then you would have your co-insurance, which would be about $69. So really on the health savings account, the amount that you would be paying out of your pocket over the premium would be about $1,710. If you were on the Buy It PPO plan, that would be a better option for you under this scenario because your expenses would be much less. It would be $810. So you would only be funding $810 over and above your premiums. Now there are some additional tax savings on the health savings account, but it would only be the additional tax on that $1,039 that you would be putting in. So the tax savings would not outweigh the savings for the Buy It PPO in this example. One more example is showing a family of 4 that's fairly healthy and just has a few office visits, x-ray, urgent care, 1 emergency room visit that wasn't very catastrophic. So in this example, the family deductible is $8,000, coinsurance is still 80%, the out-of-pocket limit is $13,100. In this example, your HSA is fully funded out of employer funds and the funds that come out of your paycheck. So your total incurred expenses for the health savings account would be $1,995 during the year. That could be paid out of your health savings account, leaving you a balance in your health savings account of nearly $5,000, $4,755. If you compare that to the Buy-Up PPO plan, you've paid all your premium and it's gone all to premium, so then you still have to pay for your care. So the amount that you would be paying over and above your premiums on the Buy-Up PPO plan is $1,530. So in this example, it's much better for this family of 4 to go with a health savings account. Which plan is best for me? Well, that's a very personal question and a very individual situation. Things that you might want to consider are how much you'll be paying in premium for the plan. The rates are in benefits in hand. Preventive care is covered in full on all 4 plans. No referrals are required to see specialists on any plan. So the question is going to be your utilization. How often do you see a doctor? Do you need to have a specialist involved? Are you taking ongoing medication? How likely are you to have services that are applied to your deductible? Is your doctor in the network? Do you need to go out of network? Do you want to pay more each month and have money put into a personal tax advantaged account in order to use it for qualified medical expenses? And if you don't, that amount grows year after year after year. If you have questions and need to talk to someone who understands benefits and is licensed and can help you, call the Higginbotham Enrollment line at 866-419-3518. You can also send them an email at helpline@higginbotham.net. Your dental plans are not changing, but the administration will be through United Healthcare this year. Participating providers can be found at www.myuhc.com and use Find a Dentist. You will be paying less out of your pocket if you use a network provider because they have agreed to charge discounted rates. You do have an annual maximum benefit, and what that means is that once the plan is paid $1,250 in benefit for a covered person, that's the most benefit they're going to get in a calendar year. And that would be given per individual covered under your plan. You have a calendar year deductible that starts over in January. It's $50 for an individual, but if you're covering multiple family members, that would be capped at $150 for your family. Preventive services are covered the same under both plans. You have basic services and major services, and they're covered at 80% for basic and 50% for major. The difference is which services are covered under basic and which under major. Under the core PPO plan, endodontics and periodontics are covered under major services, so they would be covered at 50% after your deductible. On the Buy-Up PPO plan, those same services will be covered at 80% under basic. Orthodontia is not covered on the core PPO plan, and for children, it is covered on the Buy-Up plan, and that coverage is 50% after deductible, up to annual lifetime maximum. Make sure you choose the Buy-Up plan if you have a child needing orthodontics, or if you're likely to have root canals, or if you have gum disease. Your DHMO will also be administered by United Healthcare, and again, you can find providers at myuhc.com. Use Find a Dentist. This plan is very different than the PPO plan. First of all, you have to use a network provider and you have to choose a primary care dentist. If you see a dentist that's not your primary care dentist and they did not refer you, then you don't have benefit. So make sure you see your primary care dentist for all of your care. There's no annual maximum benefit on this plan. You simply will pay co-payments for your services all year long for each covered service that you have. We have a partial listing of covered services here. There's a complete schedule of services that will be listed in Benefits at Hand if you'd like to print that out. There are also different copayments for multiple procedures. So if you're going to have a crown, there may be a build-up procedure that's billed, the crown that's billed, multiple different procedures. So make sure that you talk to your DHMO dentist about all the services that are going to be done and all the services that will be billed so that you can know your total copayment. United Healthcare will also be administering your vision plan. There are a few changes on this plan, and they are enhancements, and they're mainly in the out-of-network benefit. When you see a network provider, you have copayments for your services. When you see a non-network provider, you get reimbursed up to the maximum allowance listed. So I'm just going to be talking about the network provider options. Your exam you can get every 12 months, and it's a $10 copay. If you're going to be getting lenses, whether they're single vision, bifocal, or trifocal, it's also a $25 copayment. And again, you can get your lenses every 12 months. If you have lens options that you want, if you want polycarbonate, scratch resistant, all of those kind of options, those are additional costs. Those are not considered basic lens options. So the lens options would be discounted by your provider at the time of service. Your frame allowance is $130, so you can go into any participating provider, pick out a frame $130 or less, and that would be covered in full. If you want to get the designer frames that cost more, you can certainly do that. You will get the $130 credit, and then you would be paying the difference. And then contact lenses, they're covered in full if they're medically necessary, but if they are elective, like the majority of us, you have a $110 allowance. You can only get contact lenses in lieu of lenses for your frames. You cannot get both in the same year. Classic Auto Group provides you basic life and AD&D at no cost. Benefits do end at termination of employment or retirement. We are asking everyone to please make sure you have beneficiary information in the new online enrollment system, Benefits at Hand. But your basic life coverage is $15,000 and another $15,000 if the death is due to an accident. You also have an accelerated death benefit, so if you're diagnosed with a terminal illness, you can actually file for early payment of your claim. And there are age reductions, 65% at age 65 and 50% at age 70. Once you're a United Healthcare member, the best thing you can do is register on myuhc.com. This is your personalized online portal. You can make customized searches for network physicians in your area. There's integrated online access to all of your benefit coverage for medical and pharmacy. There are tools to help you understand your benefits, track and manage your claims, safely record and organize your family's medical history. You can also chat online with a nurse, estimate your healthcare cost, engage in their interactive wellness program, and earn gift cards. The United Healthcare Health for Me app is a great way to get connected. There's useful information. You can view and share your health plan ID cards via mail, email, or fax. You can check your account balances and benefit amounts, collect, track, and share past and current personal health records, and view and sort and save claim information. New this year, you can actually pay medical bills with a credit card or debit card or health savings account through the online app. You can estimate costs of common procedures and know your costs up front. You can find nearby providers, hospitals, quick care facilities, convenience care facilities, and you can connect with the nurse line 24/7. We are preparing an additional video entitled Everything You Need to Know About United Healthcare. Please view that for more information on all of these programs because they are very important to you and they're benefits that you have that will not cost you. First of all, premium designated doctors, Care 24, which is their EAP, their 24/7 nurse line, virtual physician visits. You can access a doctor online through your smartphone or computer and not have to go to the doctor. They have a healthy pregnancy program, health discounts up to 25% on services not covered by the health plan, gym membership discounts, and you can also learn how to earn gift cards up to $200 for yourself and an additional $200 for your spouse. And there's a snapshot of some of the gift cards that are available. If you get a phone call from United Healthcare, the first question is, why are they calling me? Well, the biggest thing is to help you. Please answer your phone because they have some important information they want to share. They may be contacting you after you've left the hospital and know that you need follow-up treatment and want to make sure that that care has been coordinated for you. Or if there's certain medications that you need, they want to make sure that you get that in order to keep you from relapsing and having to go back into the hospital. They also have programs under disease management where they have nurses review your clinical history, and if there's an issue with maybe how your diabetes is being managed or if you have coronary artery disease, they may try to help educate you and give you tools to help you manage that disease so that you can live a healthier, more productive life. Their healthy pregnancy program, they call for you on that once you have a diagnosis. And then at times a pharmacy may reach out to you and see if you have any questions on your prescriptions or notify you if there's a contraindication on something you've been prescribed. Thank you for taking the time to learn about your benefits this year. If you have any questions about your benefits or need help enrolling, call the Employee Response Center at 1-866-419-3518. They're available to take your call Monday through Friday, 8 to 5. Or you can email them at helpline@higginbotham.net.